we must go and treat malaria, irrespective of whether the malaria test is negative or positive. That one has been in our healthcare system for long. Even the health workers, many of them, particularly at the primary healthcare level, still think the same. And therefore, it affects access to the actual treatment of the disease affecting this child. You find the child put on antimalarial treatment, the child doesn't respond. They treat again, the child doesn't respond. In few months, the child is dead. So that is causing problem. So we are saying any persistent symptom or sign, your child is unwell. We want the media to let the public to know that if your child is unwell, you go for the treatment in nearby health facilities. You don't see improvement, put a question mark on that persistent fever. Take this child to the higher level hospital. For most cases, if you are very far from the National Cancer Center, like Uganda Cancer Institute, you are far from Barara Regional Cancer Center, maybe you are far from the Gulu Regional Cancer Center, which are now operational with a dedicated staff, with even expertise in cancer in children, then move to the nearby regional referral as a starting point. Then from there, they will do a number of tests to help you see whether this could be cancer or not. If cancer, then you must receive treatment at the cancer center, which could be the Uganda Cancer Institute, the Gulu Regional Cancer Center, or the Mbara Regional Cancer Center. The second symptom is swelling. Any abnormal swelling you see on the child, okay, which is not explained. You know, this child didn't fall maybe yesterday or last week and then got some swelling somewhere here. But this child feels unwell. You go to nearby facilities, they do some treatment clinically, there's no response. That persistent swelling suspect cancer in the child. Take this child to a cancer center or a regional cancer center near you for further diagnosis to confirm whether this swelling is cancer or not. The third important symptom that we need our Ugandan society to know is weight loss. You see the child is losing weight, and there's no proper explanation for the weight loss. You feed your child well, but the child is losing weight. You see, the child not just because of lack of food or malnutrition should put a question mark, suspect cancer, do investigation for cancer to rule out. Yes. The first important symptom is bleeding. Your child is bleeding, and you cannot explain the cause of the bleeding. Not just this child was injured, not just the fault with the colleague. Suspect cancer, do investigation for cancer. That symptom could be cancer. This bleeding can also be true even in adult, could be suspicious of cancer. So we are saying, if we can be responsive and we're encouraging the Ugandans, the parents, the caretakers, the teachers in school who may be with this child in school, many of our young children, they're in school, whether preschool or primary school. You see this child having certain symptoms, weight loss, fever, bleeding, or swelling any part of the body, which may not be explained by common things that can cause those kind of symptoms. Suspect cancer, do cancer investigation. So that in case that problem is cancer, it is found early, where you know you can treat and cure. And the treatment is available with experts in this country. One of the experts we have brought her here today to speak to you, Dr. Joyce Balagade. So in terms of call to action, we are calling upon the public, the parents, the teachers, the media, that we should all be vigilant about any persistent symptom, any persistent sign which is not going away, and suspect cancer in that child. And let's do the appropriate diagnosis. Not in lower level clinic or health centers, bring the person up to higher level hospital. The lowest should be a regional referral, or a regional cancer center and the cancer center. As a media fraternity, you are the biggest workforce we have in improving and influencing the society behavior. Meaning with the information we have given you, you can influence the level of knowledge, pass this information to the different media houses so that the society is well informed about this. That means you can support in raising awareness, you can support in creating advocacy for childhood cancer control, in terms of resource mobilization, you can participate in giving the information, you can participate in mobilizing the society efforts against childhood cancer control. And with these few remarks about the situation in our country, I would like to call our lead consultant in Uganda. There's no other person above her in this country in terms of expertise in childhood cancers. Our consultant, Dr. Jose Balagade, to speak to you about these golden months. And after that, we shall call our colleague also to